Hello, I'm Dr. Sri Banerjee, core faculty for the College of Health Sciences and Public Policy with a joint faculty appointment at Ross University School of Medicine. And in this video, I wanted to talk about the existence of diabetes stigma. The slogan is learn about it, recognize it, and then reduce it. So in terms of diabetes, chances are you know somebody or a close friend, co-worker, neighbor, or family member, or even you. Unfortunately, chances are the person you know with diabetes has experienced stigma or negative attitudes about having diabetes. So much of this stigma comes from people not knowing about the disease. Reducing diabetes stigma always with knowledge, education, and raising awareness is the only way that this will go down. So we're looking at diabetes that can or is affecting millions of Americans who live with today. If you remember back talking about epilepsy, there were about the 1% that had this. So this is actually a very significant amount more. And diabetes stigma can exist anywhere. I'm going to tell you some ways to distinguish this, but in the family, school, workplace, if you apply social determinants of health and look through the 5 domains, then you'll find each of them apply to diabetes. So in healthcare settings, it's important and makes diabetes management more difficult because of the stigma, and it affects one's mental health. Not to say, diabetes stigma can be internal or external. Internal, more importantly, is the beliefs that you hold about the person with diabetes. So this can lead to self-blame, shame, and guilt. External stimuli and stigma is blame and judgment that comes from other people and society. It can include awkward or mean looks, rejection, exclusion, and difficulty maintaining relationships and friendships. So learning about diabetes is a great first step to help reducing stigma. So if you know someone with diabetes, start a conversation with them. So stigma affect people with diabetes too much, and this shouldn't be there at all. But however, experiencing stigma and discrimination can affect diabetes self-care and self-esteem, and ultimately lead to serious health complications for people with diabetes. The negative emotions that people with diabetes feel from being stigmatized can cause depression, anxiety, and embarrassment. It can negatively affect how someone manages diabetes, and stigma can discourage people with diabetes from performing important day-to-day diabetes care, such as injecting insulin, checking blood sugar, and wearing diabetes devices. But these things many times are not followed. Just even getting treatment is sometimes difficult. So people with diabetes, they know blaming or shaming someone with diabetes isn't helpful. These are things that people with diabetes may want you to know. Instead, show empathy and be a source of encouragement and support. A little support and understanding go a long way. Avoid calling someone with diabetes a diabetic. Calling someone a diabetic implies that they are nothing more than their disease. Managing diabetes is a full-time job. There's no clocking out with diabetes. It's maintenance. For instance, long-acting like Lantus, and then you get another insulin that is short-acting. So this is how, and that's postprandial. So this is how much of the insulin works. Now, at the end of the day, it's still me. Diabetes doesn't define a person, and all of that support is critical. So there's some insights about diabetes stigma. I hope you were able to kind of pick out some of the more important portions of this. That's why I tried to keep it short. And thank you for listening.